we ready to go, Bruna?
Yes, I was just waiting for some people to join because we have a lot of people coming.
Okay.
So let's give them 2 more minutes.
Okay.
All right, I'm gonna play the Zoom instructions now.
Welcome to your meeting with ICM. The interpretation button should appear at the bottom of your screen, next to the Share Screen button. By clicking on the interpretation button, you can choose the language you would like to hear. The interpretation button will then transform this meeting into the selected language. To change the language you would like to hear again, follow the previous procedure by clicking on that same button. By default, you will hear the selected language at 80% volume and the original audio at 20% volume. If you would like to mute or unmute the original audio, click on the corresponding option within the language button. Enjoy your meeting. Bienvenue à votre réunion avec l'ICM. Comme la réunion propose une interprétation simultanée en français, le bouton Interprétation devrait apparaître en bas de votre écran à côté du bouton Partager l'écran. En cliquant sur le bouton Interprétation, vous pouvez choisir la langue que vous souhaitez entendre. Le bouton Interprétation se transforme alors en la langue sélectionnée. Pour changer à nouveau la langue que vous souhaitez entendre, suivez la procédure précédente en cliquant sur le même bouton. Par défaut, vous entendrez la langue sélectionnée à 80% de volume et l'audio original à 20% de volume. Si vous souhaitez couper ou supprimer l'audio original, cliquez sur l'option correspondante dans le bouton de la langue. Bonne réunion. Bienvenido a su reunión de la ICM. Como la reunión ofrece interpretación simultánea en español, el botón Interpretación debería aparecer en la parte inferior de su pantalla, junto al botón Compartir pantalla. Haciendo clic en el botón Interpretación, puede elegir el idioma que desea escuchar. El botón Interpretación cambia entonces al idioma seleccionado. Para volver a cambiar el idioma que desea escuchar, siga el procedimiento anterior pulsando el mismo botón. Por defecto, oirás el idioma seleccionado a un 80% de volumen y el audio original a un 20%. Si quieres silenciar o desilenciar el audio original, haz clic en la opción correspondiente del botón de idioma. Disfruta de su reunión.
Hello, everyone. Feel free to introduce yourself and share your comments during the webinar by clicking in the chat. And if you have questions, please use the Q&A button in the bottom of your screen.
Hello, everybody. I'm Sally Pearman, the Chief Executive of ICM. I'm really delighted to see so many of you here today at this webinar, and a few familiar names popping up, which is really nice. So welcome to you all. I'm just going to ask our 4 of us who are going to be running this webinar this afternoon to introduce themselves very briefly. So over to you, Carolyn.
Thanks, Sally. Hello, everyone. My name is Carolyn Levy. I'm an instructional design consultant located in Vancouver, British Columbia, Canada, West Coast. And I see some of you are arriving from Vancouver this morning. I've been working for ICM for about 7 years and have been helping them with the competency framework, educational standards, and empath resources. So I'm glad to be speaking about them today.
Thank you, Carolyn. Over to you, Neha.
Thank you, Sally. Hi, everyone. I'm Neha. I'm a midwife based in Pakistan and a public health specialist. And my role at ICM is Humanitarian Engagement and Climate Advisor. And you'll be hearing a bit more about my work later on in the webinar. Thank you. Over to you, Kate.
Hi, good afternoon, good morning, wherever you are in the world. Thank you all for joining us today. My name's Kate Stringer. I'm a midwife advisor at the ICM, and I'm currently based in the Netherlands, but I've previously lived in the UK. Thanks.
Thanks, Kate. Next slide, please. So this webinar is a collaboration between ICM and AIME, the Alliance to Improve Midwifery Education. And we've already run one workshop this year with AIME that was on the Midwifery Education Development Pathway, or MPath, which is the all of the educational resources that ICM has available to support you as midwife educators, which you can find on our website if you search education. So AIME, the Alliance to Improve Midwifery Education, it was founded in 2021, and it's bringing together some key partners: UNFPA, Laerdal, WHO, JPIGO, the Liverpool School of Tropical Medicine, and ICM. And we also have a number of other stakeholders involved. And it's really to try to collaborate in terms of midwifery education, keep us all on in the same direction, leverage each other's resources and activities, and share these widely across the community of midwife educators all around the world. Next slide, please. So for this webinar, we're going to focus on the recently updated Essential Competencies for Midwifery Practice. Hopefully by now you are all aware of these and have had an opportunity to have a really good read of them. So we're going to run you through the history, the background, and just talk about the relationship between the scope of practice of a midwife and the essential competencies. And then we're going to progressively look through them in a bit more depth to look at what's new, why. We will hear a little bit from Neha about you know, how they are relevant in humanitarian settings and climate change. And there will be an opportunity for you to ask questions. As Bruna already said, you can post your questions in the Q&A section at the bottom of your screen or in the chat, but there will be an opportunity at the end of the session also. Next slide, please. So just quickly to run through the history, ICM actually started working on a set of competencies in 1995, and they did, the organisation did a huge global consultation to try to identify what were all of the key activities of a midwife that could be agreed across the world. And they validated a list of global indicators in 1996. And then these were used as the basis for the first essential competencies for basic midwifery practice, they were called then, which was launched in 2002. Because they are global competencies, it means that there's been a very, very wide consultation process to develop them. And the approval of these competencies is through the ICM Council, which has two representatives of each of our 136 midwives associations. So the council meets every year. Once every 3 years it's in person, and they are the ones who approve the global standards, the competencies, the definitions, the documents that we call in ICM our core documents. they're central to the work that we do, and they are global because all of the midwives in the world have agreed with them. So 2002 was the first time we had competencies, and I should say we are still the only profession that has global competencies. They were updated in 2010 and 2013. Those of you who've been around as long as me, or maybe not quite as long, will remember that those early competencies from 2002 to 2013 update were essentially a list of 7 standards or 7 competency statements. In 2019, we had a major change and we developed a new framework, which Carolyn will explain shortly. And there were 4 categories of competencies that were identified. So there was a very big change in 2019, and we removed the word basic. So now these are the essential competencies for midwifery practice. And then at the end of 2023, we commenced a global consultation that many of you were involved in. And through the process, we then took a new set of competencies to the ICM Council in 2024 in June. These were approved, and now the 2024 update is what we are taking you through today. And as Carolyn will explain, we now have 5 categories of competency. Next slide, please. I want to bring you back to the international scope of practice. So ICM has a document that you should all be very familiar with called Definition and Scope of Practice of the Midwife. And what we say is, who is a midwife and what is it that that midwife can do on her own responsibility? That is the scope of practice of a midwife. And you can see it here. The scope of practice of a midwife is to provide care for women and newborns across the pregnancy and childbirth continuum, starting in pregnancy, through the labour and birth, and through the postnatal period up to 6 weeks. While the woman and the baby are having a normal process, it's physiological, everything is going well, the midwife can provide that care herself or himself. And that's what we can do on our own responsibility. That is our scope. If the woman or the baby develops any complexity or any complications, then we need to collaborate with other specialists such as obstetricians, neonatologists, paediatricians, and so on, to meet the specific needs of that woman and her baby. So that is essentially the central part of the scope of practice of a midwife. But we do go beyond the pregnancy and childbirth continuum. So we do also work in sexual and reproductive health and rights, health promotion, advocacy, etc. And we really want to integrate with pre-pregnancy care and beyond the childbirth continuum into aspects of women's health. And we do that. But the main part of what we all do is this pregnancy and childbirth continuum. Next slide, please. I also want to draw your attention to the ICM professional framework for midwifery, which, again, I hope you're all familiar with, especially as educators. As a unique profession, we have our own professional framework, and we've identified 10 essential elements that we say need to be in place in any country to have a strong midwifery profession. You can see in this diagram that it's set out like a puzzle because all of the pieces are interconnected and rely on each other. And if one of them is weak, all of them will be weak. But right at the very centre, you can see essential competencies for midwifery practice. So everything that we do as a midwife comes back to these competencies and the scope of practice. Next slide, please. So Our definition and scope of practice sets out the boundaries of what a midwife can do on her own responsibility. And the essential competencies set out the knowledge, skills, and behaviours that midwives need to be able to work across that scope of practice at the point of entry to the profession. So as we finish our pre-service education, we should all be able to demonstrate that we meet these competencies. As we enter the register of midwives in our country, we should be able to demonstrate that we meet these competencies. And as we continue to practice across our professional life, we should remain competent with these competencies. So they're a minimum standard. All midwives should be able to practice according to these competencies and across their professional career. Next slide. Okay, I'm handing over to Carolyn.
Thanks, Sally. So you'll see here the structure of the Essential Competency Framework. And the biggest change we have from the 2019 framework is that we have an additional category now. So there are 5 categories of competencies that reflect what Sally was just saying, the ICM's philosophy and model of midwifery care, in addition to the integration of the ICM international definition and scope of practice of a midwife. So this competency framework is intended to support the development of midwifery services worldwide, and as such can be used by a variety of stakeholders and in multiple ways. So primarily we see it for educational use, and we've seen midwife educators using this competency framework to create midwifery programs of study such as Bachelor of Midwifery or a diploma. We also see them using the competency framework to shape midwife faculty development programs and activities, and also having students assess themselves against the requirements for competent practice by using the essential competencies. In addition, the competencies are used by governments to establish or strengthen midwifery services in country, by regulators to prescribe the scope of practice and minimum standards for entry to practice, by midwives associations to advocate for strengthening the midwifery profession and create continuing education opportunities within country. And finally, we've seen midwife consultants and stakeholders use the competencies to establish and evaluate midwifery services around the world. Next slide, please. So the competencies are listed under these 5 categories, and what they do is express what we want to see as a competent midwife. And when we talk about a competent midwife, we're really talking about a person who is able to perform a task or an activity consistently over time and in different situations to a defined level of proficiency. In this case, we're saying entry to practice. So the competencies listed in this framework define a midwife's abilities to integrate the knowledge, skills, and behaviors required to perform the activities and tasks for entry to practice. The competencies that are listed are interrelated and interdependent. This means they cannot be learned or observed or assessed in isolation, but only within the context of practice. So we see the ICM Essential Competencies helping educators to achieve a number of things. They support competency-based education, which is an outcomes-based approach to learning that situates knowledge and skills in the context of midwifery practice. They provide information on the knowledge, skills, and behaviors to be integrated into the midwifery curriculum. And they provide precise information for assessment purposes to evaluate performance. So in this slide, what you'll see is that the competencies are listed in the left-hand column in the framework. Each competency statement has a corresponding set of indicators comprised of the required knowledge, skills, and behaviors to demonstrate that competency. These knowledge, skills, and behaviors help midwife educators to develop learning activities and assessments progressively over a program of study to help guide students in the classroom and clinical practice. So for example, when you see a knowledge component, it's normally introduced in a theory module and then drawn on in the clinical and practical modules that focus on the development of skills, attitudes, and behaviors. And the integrating of these ICM competencies throughout the program ensures that midwifery students have opportunities for practice, meaningful feedback, and the achievement of becoming a competent midwife. Next slide, please. So I've always said that competency frameworks are living documents, and the Essential Competencies for Midwifery Practice is a living framework. And what do I mean by that? It's really, this is a document that responds to the needs and changes of the midwifery profession over time. And as new practices and technologies emerge, the competencies need to be reviewed and revised to remain current. And as Sally mentioned previously, this is what happened in 2023. So at that point, ICM decided to update the 2019 competency framework to reflect changes in midwifery practices. There were changes in the ICM core documents and position statements, the guidance documents, as well as to address some inconsistencies. So a project team was created, including myself, to conduct a literature review and a professional scan. And it became clear at that point that there was a need to provide more detail about prescribing medications, use of new technologies in the care of women in pregnancy and childbirth, emergency interventions, abortion and contraception and family planning competencies that aligned with the WHO's updated competencies. And furthermore, there was also a need to include competencies for midwives responding to climate change and humanitarian crises. So after doing this literature review, environmental scan, and professional scan, we went through several rounds of feedback from key stakeholders. And as Sally mentioned, many of you were probably involved in that. And the new revised competency framework was approved by the ICM board and council. And the biggest change to the framework was the addition of a new category, which Kate will now discuss. Thanks. Kate?
Thanks, Carolyn. Next slide, please, Bruna. So here are the updated competencies. For the first time, as we've touched on, the ICM has captured the competencies across 5 categories rather than 4. Category 1 is a set of cross-functional competencies that apply to each of the other 4 categories. And they're categorized that way to make sure that we don't duplicate within the other categories. Category 1 competencies relate to the midwife's autonomy, accountability as a health professional, and the relationships with women and other care providers. And they apply to all aspects of midwifery practice. Category 2 is the new category related to sexual and reproductive health and rights. Whilst the overall Category 2 competencies have existed in other iterations of the Essential Competencies, we felt it was important to make this group more visible and provide more clarity. So we've grouped these competencies together to make it easier for midwives, midwife educators, and government agencies to ensure midwives are able to develop these skills and services to meet families' needs. Category 3 is antenatal care. Category 4, care during labour and birth. And Category 5, the ongoing care of women and newborns. The updated Essential Competencies for Midwifery Practice have also had updated design and imagery. It's really important that their imagery captures the work that midwives do all over the world. In our increasingly digital world, we know that the imagery and how midwifery work is portrayed is rightly important to our members. We really hope you like the new design. We've got a whole new updated website, and actually the website won a global award yesterday. So do go and have a really good look around the website. Next slide, please. So these are the specific competencies related to category 2. Competencies in this category are about midwives' broader role in sexual reproductive health, counselling, education, including contraception, preconception, and comprehensive abortion care. This care is provided to women, adolescent girls, gender diverse people, and the communities and wider families as identified in the international definition and scope of practice for midwives. I'm just going to read the 6 competencies out for the translators. So the competencies are: provide education on sexual and reproductive health, contraception and family planning, provide support on natural family planning and barrier methods, administer contraceptives within the scope of practice, provide preconception care, care for girls and women who experience physical and sexual violence and abuse, and provide comprehensive abortion care within local laws. As you're aware, the full document breaks down these competencies with greater detail, including the knowledge, skills, and behaviours that the midwife or midwife learner needs to be able to consistently demonstrate to meet these competencies. As always, these skills and competencies do not exist in isolation, and usually midwives will demonstrate competence in these skills whilst combining them with other elements of practice, particularly those in category 1. We're really proud to see the existence of category 2, as this was particularly important for our midwifery associations. The WHO Safe Abortion Care Policy, published in 2022, estimates that around 5 to 12% of all maternal deaths are related to unsafe abortion care. And around 25% of women who wish to avoid pregnancy do not have access to the contraceptive care that they need. Addressing this urgent need for women and families can be transformative for improving maternal and newborn health. Midwives are ideally suited to provide this care, as they're often local trusted practitioners working in the communities in which they serve. Improving the knowledge, skills and competencies midwives have in sexual reproductive health and rights will enable culturally sensitive care to be provided. Midwifery associations wanted to ensure the competencies reflected the vital work midwives do in supporting families' reproductive health and provide clarity and alignment with the WHO's abortion care policy. Sorry, one second. In many settings, both in the global north and global south, we know midwives are not enabled to fully meet these requirements, and we urge all midwifery associations to use these essential competencies to review practice in their own settings and identify any advocacy, policy, training, and improvements which may be required in order for midwives to meet their full potential. Next slide, please. So there are many changes in the updated 2024 iteration of the Essential Competencies for Midwifery Practice. However, overall, there's only 10% new competencies. And as we've already said, the scope of practice for a midwife has not changed. However, in view of the changing landscape in global maternal health and updated global evidence, the application of the competencies it's vital that we update the language, including increasing details where this is required, to ensure that this document remains relevant and globally applicable. Some competencies have been reworked to make the language clearer and provide clarity. And in other cases, we've provided additional information or reduced duplication to make them more relevant. During the review process, it's been vital to provide enough detail to support midwives, midwife educators, and others to implement and apply the competencies in their practice. And as Carolyn already shared, the process of ensuring all midwifery associations have inputted and agreed with the final version of the competencies has been extensive. It's really important to read the competencies in full and make your own individualized assessments on your own practice. Or if you're an educator, consider how you can implement the new and updated 2024 competencies within your educational programs. We're hosting another webinar in a couple of weeks' time where we're going to really talk about how you can integrate the competencies into your curriculums and programs, and I'll share more details about that at the end. So amongst other areas where we've provided more information, we've also included increased focus on midwives' roles in humanitarian crisis. We know that women still need sexual reproductive health and services, even in a flood or a fire. Babies will continue to be born. And it's really important that midwives are prepared and ready to provide services in these circumstances. Neha, my colleague, is going to talk a bit more about the midwife's role in these circumstances in the next section, so I won't provide any more information now. Another area that we've provided additional clarity on is the appropriate use of technology. It's important that midwives remain up to date with digital tools, AI, telehealth, and remote monitoring systems. Evidence has demonstrated that where women have increased access to digital support, this can increase self-agency and safety. But midwives must also critically analyse the use of emerging digital tech, balance the ethical challenges and the risks of implementing technology without underlying robust evidence, or implement technology that may have unintended harm, for example, acting as a substitute for the midwife-mother relationship or instead of the provision of maternity care. I've drawn attention to just a couple of the competencies here, but we advise you to review the document in full in further detail. I'm now going to hand over to Neha, who's a midwife living in Pakistan. Neha works for the ICM as a humanitarian engagement and climate advisor, and she's going to share her experience of climate disaster and the need for essential competencies in this area to provide safe, effective care. Over to you, Neha.
Thank you. Thank you so much, Kate. So as introduced, I am a midwife working in Pakistan, and Pakistan is a very climate affected country, and we have experienced a lot of humanitarian crisis as well. In my work, I have worked in an earthquake, I've provided care in a flood, I've worked in other climate affected communities as well, which I'll talk about. So this photo you see in front of you, it was taken in 2022 during flood relief efforts in Pakistan. So this is myself and another midwife who worked with me. And this area that we're in was an entire village, which is now covered with water and has become a lake where we're in a boat. So to put this in context, this flood affected around 33 million people, which is, as you can imagine, a very significant proportion of the population. And it damaged 2,000 health facilities, which as it's a very massive disruption to an already fragile healthcare system. So pregnant women and newborns were left extremely vulnerable, and not just because of the dangers of the flood, but because of the lack of access to essential services. So my team and I were on the ground. We were providing care to displaced women. And what we learned then was that the needs in a crisis of this magnitude were very diverse. And of course, there were the urgent needs, but there was the urgent need of safe birthing services, but we were also managing issues with antenatal care. We were ensuring the health of newborns, disruptions in breastfeeding, and we also encountered women struggling with longer-term consequences of displacement. So lack of access to family planning, increased risk of reproductive health infections, and often sexual violence in many cases. So, and what I really thought about in this experience was what was really brought into sharp focus was this need for midwives who have the knowledge and skills to provide a full spectrum of care in these environments. So humanitarian crisis, climate crisis is now a very big part of our reality. And when we were in it, what I couldn't help thinking about is the flip side, that if we had midwives who knew how to provide this care, how the situation would be very different. Midwives in crisis, they really need to be able to be adaptable, resourceful, and be able to address a wide range of physical and psychosocial needs. So as we know, climate change isn't always just about extreme weather events. This is one example, but it's also about the gradual, ongoing, everyday challenges that affect the health and well-being of communities. So another example that I wanted to share is that I also work with a coastal island community. I provide care in this community that's experiencing the daily realities of changing climate. So it's because it's a coastal island. We have rising sea levels, we have extreme heat, we have constant threat of cyclones, sea storms. And in this community, we see the direct impact of climate change on maternal newborn health. So I have seen in my own clinic, there's a really large increase in adverse birth outcomes linked to extreme heat, persistent outbreaks of disease due to environmental degradation. There's a decline in nutritional status because it's a fisherfolk community who's lost their source of livelihood. And we're also seeing a rise in mental health challenges and gender-based violence, which are, as we know, are quite closely related to the stresses of a changing environment and economic insecurity. So as a midwife who works in this community, I've also had to become an advocate for climate conscious healthcare. We've established a health center that runs on solar energy. With the community, we promote environmentally sustainable practices. We provide psychosocial support where possible. We utilize telehealth to overcome geographical barriers. We're always engaged in emergency preparedness planning. And I provide care at this island, and there's often midwives who come in and support me. Often there's students who come in and out of the clinic to support. And whenever I see these midwives providing care, I think about how competency, evidence-based education on what is happening to women and babies as a result of this changing environment would really have equipped all of us so much better to manage our roles here. I also want to talk, at my role at ICM, one of the things that I've done with other colleagues, last year what we did was in 2023, we conducted a survey of our member associations. They have a member needs survey. And the results, we asked associations what it was that they needed in terms of what their work was in climate and humanitarian settings and what they needed. And 62% of the respondents indicated that they had either worked directly in disaster or climate-affected settings, or they served populations who had been displaced or experienced a crisis. So midwives said that they needed more guidance content and they needed to provide care in these contexts. Next slide, please. So this photo...
Sorry, just before you continue, can you just slow down a bit for the interpreters? Thank you.
Sorry. Yes, absolutely. So this photo is from our colleagues at the Moroccan Association, that's AMSF. So in 2023, in September, there was a devastating earthquake. It hit the Atlas Mountains, and AMSF, the midwives in AMSF, they wanted to provide response. So we connected AMSF with a donor to support their emergency response efforts. And ICM also developed some key resources on emergency response topics and how to support midwives in providing emergency response, the kind of advocacy strategies they can use, the skills that they need to implement the minimum initial service package of reproductive health in crisis situations. And while we were on ground working with these midwives, very skilled midwives, this experience, what we really learned was that midwives are willing and able to play a crucial role in crisis, but often they just do not have a clear understanding of how to integrate their skills into the broader emergency response framework. So how does their scope of work connect with emergency response? So where do we go from here? The evidence is clear. Climate change and humanitarian crisis is impacting the health of mothers and newborns. Midwives, with their focus on community-based care, as Kate mentioned as well, are uniquely positioned to provide sustainable and environmentally sound solutions. And in disaster situations, midwives, as many of you will know and have provided care, are often the first responders, which means that they minimize the disruption that women experience in humanitarian settings. But what we're hearing again and again from midwives and associations is that, yes, lack of resources and funding is a big barrier, but there's also this lack of clarity regarding the midwife's role and what she can do autonomously and what the skills are and skills and knowledge are that she needs to have to work. After the floods, I spoke to midwives on ground, and one of the many challenges they highlighted was that we couldn't mobilize because we don't know if we're allowed to do this work or if we're supposed to do this work. So that with technical capacity limitations is a really big challenge. And because of this, we see a lack of involvement of women and midwives in preparedness and response planning, which means that because they're not part of the preparedness and response, they cannot provide that response. So as part of what we're hoping that will come out of this, out of these competencies, we want midwives to also be able to advocate, midwives and associations, for the unique needs of pregnant women and newborns, and ensuring that when there are preparedness planning, their needs are factored into resource allocation and disaster response. So in next slide, please. So this is a bit of where we midwives on the front line. So this is the community that I work in. And you can imagine the kind of skills around climate change that are required to work in the community with this level of environmental degradation and rising sea level. And these are a few of the things that we work with associations on. And the essential competencies, they are very, as others mentioned before, also they're very squarely with the work within the scope of practice to add expertise in specific areas, such as understanding the needs that populations, including refugees, migrants, displaced populations, what are the needs that they have, how to be adaptable, how to work with limited resources, providing mental health support and recognizing mental health crises that occur as a result of this, collaboration, and remaining flexible and adaptable in your practice when you're working in these settings. But also taking that knowledge, being aware of what all these connections are, using knowledge equity as part of your work. So this is where these competencies come in, and this is what I've seen in my experience as someone who works in a situation in which this kind of competency-based learning is very important, but also in my role with association strengthening, how I see it's important for midwives and associations globally. So thank you.
Thank you, Neha. So I think you've had quite a quick run through of the background to how we've done this update, the linkage between the scope of practice and the competencies, and a very specific example from Neha about why we needed to add an additional competency around preparing midwives to work in humanitarian crises and to be aware and understand the impact of climate change on mothers and babies and pregnant women. We have about 20 minutes left, and I'm not seeing at this stage very many questions. So please, if you have questions, additional questions, please add them in the chat if you can't see the Q&A button. So just before we move into the question and answer section, I want to just talk about, as by way of summary, how the competencies can be really used to strengthen midwifery practice. And there's a number of ways. Several of my colleagues have mentioned the importance of advocacy. And I think this is really a big opportunity for you. If in your country there is not a prescribed scope of practice, and very often there isn't, or there is policy that restricts you from working in certain aspects of midwifery care, or if it's just silent, you don't have anything to really help you, you can use these competencies for advocacy and say, look, this is what the global community of midwives believe midwives should be able to do in any country, and really try to work with your governments and your regulators to do that. Specifically, what we want is for governments to really strengthen midwifery services in every country and make a legal statement about the scope of practice of a midwife. So we really want our ministers of health to understand who a midwife is, what a midwife can do, why a midwife matters, and why they should invest in midwifery services. So these could be useful, this could be useful to refer them to the competencies. Midwives associations have a really big role in advocating for strengthening of the profession, and also in creating continuing education opportunities for members. So you might decide as a midwives association that you want to run some training on, you know, perhaps one category of the competencies or several of the competencies to help your colleagues to update their knowledge, their skills, etc. And this is really important continuing education that you could be doing as a midwives association. For midwife educators in the audience, of course, we really want to encourage you and support you to make sure that the pre-service midwifery education programs you're running do have these competencies embedded in them so that you are developing midwives with the knowledge, skills, and behaviours that are set out in these competencies. They should be, you know, there should be a process at the end of every program whereby the students who are about to graduate can be assessed to see that they actually do hold these competencies. And then if you're doing other levels of education for midwives who are already registered, you can still use the competencies as the basis for some of that education. Because as midwives, this is the minimum set of competence that we need to maintain throughout our career, as I said earlier. We want to encourage and support midwifery regulators to prescribe the scope of practice of a midwife. And to use our competencies, they can just adopt them or they can adapt them to set a minimum set of competencies that are required in any country for midwives to enter the register of midwives. So these competencies can be used as part of the registration process. And if you've got midwives from another country who want to come and work in your country, they could be assessed against the competencies that are set by the country, and then they could be registered. So there's many, many uses here. Obviously, midwives in practice can use the competencies to guide their practice and their continuing education. And for students who are developing their skills and knowledge and behaviours as midwives, the competencies are a really good guide to what it is that you need to know, what you need to be able to do, and how you need to behave in the kind of attitudes that you bring with you to your practice. And ICM and Leerdal have a resource that may be of interest to you in midwifery educators in the room, which is the peer-to-peer competency learning tool, where students can self-assess. We have numbers of scenarios, it's on the phone, accessible, and students can assess themselves against different scenarios, and all of the scenarios and all of the questions are linked to the 2024 Essential Competencies. And midwife consultants and stakeholders who are often involved with governments or educational institutions, we really need them to use the ICM competencies and the standards for education, because we want to have a consistent standard across the world. So these are just some of the ways that you can use the competencies. And I'm just having a very quick scan. I see there's quite a lot of questions now in the Q&A. So shall I just begin from the top, and Kate and Stephanie, just interrupt me if you want me to. But I'm reading the first one, Georgia Cartes. From the ICM, we focus on sexual reproductive health, midwifery within gynecological and sexual health. How do we advance in that, being the guarantor of rights for women? Well, I mean, I actually hope that these competencies can help you with that, because we do talk about, you know, the rights of women within our competencies, and the importance of a midwife upholding women's rights for access to sexual and reproductive health. So I think that if you really read through the competencies, you're going to find that this is exactly what we're saying that midwives need to do.
Sally, there's another question sort of around similar to that, around how do educators support students to sort of gain competencies in sexual reproductive health, particularly around abortion care, where maybe it isn't facilitated in country? Have we got any advice for those educators?
Well, I mean, there's learning the skills and the knowledge, of course, in the classroom. There's also simulation activities. And then I think building relationships with those who are providing that care to women in your country, so that students can have an opportunity to have clinical placements where they are able to learn alongside those who are doing this. But there's possibly others in the room who can answer that as well. So please, if you have an example from your country, please do put it in the chat. I'm going to move on to Elizabeth Kavanagh, the network that permitted you to access those who needed your support. Okay, so we're very connected with our midwives associations, and obviously we are aware when a disaster happens, we contact our associations and we ask them if we can help. In the case of Morocco and others, we have been able to work with partners to get funding for the association to be able to respond in whatever disaster it is, and we have been able to support those associations to do that. And through that process, we've learned a lot. We are developing a resource that we will be making available to every midwives association to help them to prepare for when it happens to them, as it most likely will for all of us.
There was a couple more questions sort of around that topic. People sharing that in their country that often midwives have not been included in disaster care planning, and how and what a challenge that's been. And I think that's exactly why we've wanted to make it a focus in the competencies, because we know that that is a challenge, and within the knowledge, behaviours and skills there's a lot of detail about what student learners and midwives can learn to help them have a seat at that table and help them be ready to provide care in those circumstances. I don't know if Neha or Sally wanted to add anything onto that.
No, but I would say that that's a very good answer, Kate, because I mean, in the end, we're not going to be asked. We have to actually knock on the door or knock down the door and say we need to be at the table. And we need to then show that having us at the table is of benefit, because I think midwives are often invisible. COVID showed us that midwives can be very innovative in how they provide care in difficult settings. And we've got a lot more research evidence now since COVID. So I think it's about demanding to be at the table as much as anything. We can't wait.
And I think that's what we hope these competencies offer, is that once we have the skills, knowledge and behaviours, and we're ready for those opportunities, and we can go out and get them. So hopefully that's what these can help support you with.
Exactly. Can I just mention very briefly Sarah Hinton? Look, ICM is fully involved in the transition to midwifery models of care work. We've been we've been co-leading it, actually. So the position paper, which is now out and took a year, we've been totally involved in that, and we're now very involved in the implementation guide. What we hope is, because it's these documents are going to refer to these competencies, to a lot of ICM resources, we really hope that the transitioning work from WHO is actually going to support our arguments with governments to invest in midwives, and then the flow on of that, of course, into midwifery education, into practice.
There's a good question here, Sally, around there are many different kinds of midwifery education programs, including certificate level, diploma level, undergrad and grad level. ICM competencies and global standards do they apply similarly to all levels of midwives?
Yeah, I mean, our standards are about what does a pre-service program need to be to produce the midwife that can be registered in a country. We're not about the qualification. We don't say it needs to be a degree or a diploma or a master's or any other thing. We say this is what the education program needs to provide, including the amount of clinical practice that students need access to. And the competencies need to be embedded into the teaching and learning strategies and the clinical practice, so that the graduates can demonstrate that they have these competencies when they finish and as they enter the register.
Yeah, and these are the essential competencies for all midwives throughout your career.
That's right, yeah.
Just scroll
we
down.
know we don't have a place on our site, on our website. In fact, we probably wouldn't really be able to manage this to help students find internships, etc. I'm sorry, you need to work through your midwifery school for that. Okay, looking through. I mean, it's not ICM's role to incorporate competencies into curricula. It's the role of educators. We can help you. We have resources on our website. We will be talking more at the next webinar specifically about this. But in the end, it's up to the education providers, the regulators in a country to do this.
A couple of questions around MISP or MISP. I don't know, Neha, if you want to just explain what that stands for.
So I think
and
there
why
were a
it's
few
important.
that I answered in the chat box as well. The MISP is the Minimum Initial Service Package for Reproductive Health in Crisis Situations. And I think someone also asked that you recommend that this be made part of students' learning. So it's actually supporting the MISP as part of the skills and behaviors that we recommend in this competency. So because when there is a disaster, this is the minimum initial service that should be given. It includes sexual and reproductive health, pregnancy, emergency obstetric care, neonatal care, all of the things that are required in an emergency. So this should be the basis of any work that is done in emergency response.
Thank you, Neha. Can I mention back Tawa? Sorry, I'm not pronouncing you correctly. Look, midwifery is the only profession that's got global standards. It's absolutely brilliant. I know from our obstetric and nursing colleagues that they wish they did. So it's not about a need to specifically have them for midwifery. It's because midwives were proactive in developing them. And it's been very, very powerful for us to have them. Okay, well, Michaela, you and I could have a whole conversation about the word advanced. Let's take that offline. It's not my, I don't believe in advanced practice. I think a midwife is a midwife is a midwife, and we deepen our practice with experience. But these competencies apply, to all midwives and all programs.
I mean, there's something we've been discussing. We've discussed that before as well, Sally, haven't we? Around, we acknowledge that to deliver all of the essential competencies, can be a challenge in some programs, but there are some places that are being able to do that with really innovative program designs, different models of care, where students are following women and working in different ways. So we hope to share more around that really, and share amongst yourselves about places that are managing to deliver that. But we know it's a challenge, but we hope that it's an ambitious one that we need to strive for.
And can I step in here? When we were developing the competency framework, when I came on board to do the 2019 revision, and this came up in terms of establishing that proficiency level for entry to practice, there's nothing stopping anybody from moving beyond this competency framework. This is entry to practice proficiency. And we say that the indicators are the minimum standards. So if you want to expand beyond that, we welcome that. And for you to develop it. This is a living framework that people should use and adapt to their context. So I think that's important to understand. There's no limitation here. You can grow this framework beyond it. And we see that, I saw that across many different countries where they use the ICM competencies as that entry to practice level and then contextualize it. Here in Canada, we have an Indigenous framework. So to contextualize it to the country where the midwives are practicing.
Thanks, Carolyn. Frederico, I hope that you've had the answers to your questions, because I think they've come through in what we have said. But keep an eye on our website, because we will be developing further resources for preparedness for midwives in crisis settings.
So we're at time.
We are at time. So yeah, I'm very sorry for those of you who didn't get your question answered. Feel free to write to us at membership@internationalmidwives.org, and we will respond to you individually. Hopefully, though, most of you, I think, would have had your answers. And thank you all so much for your participation. Kate, let me just pass it back to you.
So thank you all so much for joining. I hope you feel as excited as we are about these updated competencies. And we really want to hear your stories, and, you know, do share with us what your experiences are of, you know, implementing these in your services. We have got, I've touched on it already, but you can see here on the slide that we've got another webinar in a couple of weeks around integrating the ICM competencies into midwifery curriculum. The ICM has created a number of tools and resources to support you as educators in doing this process, and we will explain more around that in the next webinar. And then the last webinar in this mini series is on the 11th of December, where we're going to be talking about recognition and incorporation of prior learning, and how you might be able to use that in your services. So thank you all for joining. I think the QR code, or there's a link in the chat just for like a 3-question feedback about, you know, what you've taken away from here and what you would like the ICM to cover in future webinars. But thank you all for joining, and hopefully see you all in a couple of weeks' time. Thank you.